Yes. Hello, everyone. If you're out there and want to learn about patient identification or rest your feet, come on and take a seat. My name is Kaycee Kaplin. I am the Chief Marketing Officer of Premier, and I'm thrilled to be here with Morgan Adams.
Thank you.
Who is National Accounts Director.
Yes, National Sales Manager for Premier. So Premier is my biggest customer, and I'm thrilled to be here with you.
Well, we're really thrilled to have you here. I have to tell you that we're going to talk a lot about patient identification, innovation, and I asked Morgan if I could have one of the PDC bands, hospital bands today, and it is so comfortable that I forgot I was wearing it, and everyone keeps asking me if I'm okay and if I was in the hospital last night. So that's a testament to how incredibly great it is. But Morgan, let's just kind of go ahead and dive in because we don't have a ton of time.
Yeah.
How does this topic, patient identification, impact healthcare workflows, and why does PDC believe that it matters?
Yeah, so patient identification is in every aspect of care, from admitting a patient to collecting labs, administering medication, and even discharging a patient. It's not just a name on a wristband, right? It's a barcode that connects that patient to their record in the EHR. And when that process gets disrupted, maybe the wristband falls off, maybe the barcode doesn't scan, that patient then becomes disconnected from their treatment plan. And it's going to cause workflow frustrations, rework, and at the end of the day, it's patient safety that's on the line. So we really want to ensure that the hardware and media that's being used, from the wristbands to the labels to the printers and the scanners, it's all specifically designed for a healthcare environment. When all of those items are working cohesively together, you're going to have what's called a worry-free workflow, and that's something that PDC loves to emphasize and do.
That's awesome.
Thank you.
So tell me about how that plays out in the real world. Like, what happens when in the clinical setting when ID doesn't work?
Yeah, so I think we all know, right? Nurses are extremely resourceful. Their goal at the end of the day is to ensure that they're taking care of the patient in the best way possible. If that process doesn't work, they're going to create a workaround. But that workaround is a symptom of a broken system. And so a perfect example of this is the recent work we did with Atrium Health. They came to us and we discovered a workflow improvement opportunity where we brought the patient banding in the emergency department to the bedside. And by doing this, we reduced the door-to-doctor time by 47%.
Wow.
And that number is a big number, right? Yeah. And what's great about that is it helped with throughput. They were seeing more patients, getting more people in and out of the beds in the emergency department, and then it also improved patient satisfaction, which we all know is very important when patients come to a hospital.
Wow, that is incredible. You seem like such an expert on this topic, so I have to ask, because we do have a lot of member hospitals and health systems, and even beyond the acute setting to the continuum of care here. So what advice would you give to them when it comes to how they identify their patients?
Yeah, I have 3 recommendations. The first is going to be convert to a thermal printer. It's fast, reliable, it's going to reduce reprints, and you're going to have cost savings with it. We, PDC, recently came out with what we call a Certus C130 printer. It's a new innovation. I know it's wristbands and labels, and it's not the most attractive, but I think it's an awesome innovation. We're forward thinking in this, and what this is doing is clinicians love how easy it is to use, and IT loves how easy it is to set up and continue to manage. Because what happens is when you plug the printer in, it's an easy drop-in. It works with all of your different EHR systems, whether that's Cerner, Epic, or Meditech. It's really just a plug-and-play option, and we actually have some on display that we can take a walk to later, and I can show you.
We're going to walk over there. All of you are going to walk with me over to this booth and get your own little custom funny armbands. So tell me, so I love it, obviously, because it's so simple and easy and comfortable, but tell me again some reasons why clinicians love it.
Yeah, so this printer, it's actually an open face carrier. So what clinicians, nurses, are able to do is they can see how many wristbands are left on the carrier. So they can see, okay, do I have to plan ahead? Do I have to, swap something out? But also if it jams, it's really easy to fix that. They don't have to throw away the carrier. They don't have to throw away the unused wristbands because a jam occurs. So what that's doing for the system, it's providing savings. It's providing, opportunities to quickly resolve an issue if needed. Our wristbands have 250 rolls per carrier. So less time and less shift during a change out, which is fantastic.
That's awesome on the clinician side, but they're not the only stakeholders. So what about the IT teams?
Yes.
How do they feel?
The thing with the IT teams is it's very easy to set up, and I'm more than happy to dive into this. One thing with Brady is we have this label sense technology, and it allows for any carrier that goes in to easily recalibrate. So if you have to change something out, you're not expecting the clinicians to do it. The IT team can remotely do this from an app that we've created, which is fantastic. But what's awesome is with the EHR system, when it's connected, the printer just connects, and the IT team can do everything remotely. So it's an awesome new option.
Wow, incredible. Okay, so I imagine with all of these benefits that it's really important to choose the right partner. So tell me a little bit about that.
Yeah, and one other thing I wanted to say, because I mentioned there's 3 recommendations, so I just want to bounce back quickly. So apart from choosing the thermal printing, the second thing would be the scanners. So the barcode scanners is not always the wristband or the label that's the issue, but when scanners don't work, it could just be that the scanner is old, or the scanner is not specifically designed for healthcare. So what we want to do is focus on doing a refresh. And wristbands nowadays, they're shiny, as you can see, right? They're soft, they're smooth, and same thing with specimen labels. So we specifically have scanners that can now scan, and you're not going to have any issues at all. And then the third piece of that as well is that you asked about the IT. There's a little bit more information. We actually have a field engineer team guy at our desk that can answer all of these fantastic IT questions. But when you do a conversion with the Certus C130 printer, you're going to be able to, like I said, do an easy drop-in. We do adjustable ZPL settings, so you don't have to completely change your wristband format. And it's a big, big win that IT is loving, because they've really never had this option to, reduce service tickets, get and fix these printers as fast as they're doing. And what allows for a massive, scalable, secure rollout for the hospital is something that they're loving, because these printers also don't hold any of the patient information. It's completely HIPAA compliant. We can totally disconnect the USB port and add password protection to it as well.
Wow, incredible.
Yes.
Well, thank you so much. This has been such a great conversation. I know we have a few minutes left. Before I get to our last question, can I ask you something personal?
Yes.
Since we have so many audience members today.
Of course. How personal? I'm just kidding.
When we were prepping earlier, you said you moved across the country.
I did.
Tell me about it.
I moved from Los Angeles because the weather there is just horrible, right? The sun, the beaches, and all of that. My husband and I decided to move across the country back to Michigan, where we're from. So I'm now in Metro Detroit. So if anyone's a Michigander, you kind of know we point on the hand. So I'm close to Metro Detroit. Appreciate that from the audience. But yeah, excited to move back, be closer to family, and hopefully start a family one day.
Maybe I can moderate this session next year and ask you how it's going.
Yes, hopefully I'll be here. Yeah, I'll be here.
Okay, so this has been just such a helpful conversation. I hope we have certainly some IT professionals and clinical staff in the audience that have found it helpful. Any final thoughts for anyone here present or watching this session?
Yeah, a couple final thoughts. So when you're looking to choose a supplier, you want to choose a partner. You want to choose someone that's going to help you think strategically, help you think about the future and not just the now, even though the now is what we've been talking about at Premier for this week. But you want to think about the future when it comes to operations and workflows. So I would say choose a supplier that is a partner that's going to have a connected care solution. So that's wristbands, that's labels, that's printers, scanners, and honestly, support, right? We don't just want to sell you an item. We want to be there through the thick of it. We want to ensure we're asking you the right questions. You're telling us your problems. We want to be that solution provider. And it's something that PDC strives on. We have a handful of people in the field. We recently just did a Value Plus analysis, which helps do standardizations within hospitals. And we had a field rep with McLaren actually partner and identify that 17 label SKUs were being used across the system. What we did is we reduced that down to 5, and we saved them 20%. So it's really just, like I said, I know wristbands and labels isn't something that is at the forefront of your mind, but it's something so small, like 10 to 15 cents, that can cost the hospital hundreds of dollars with medical errors and issues. So it's something that we really want to focus on. And like I said, to wrap this up, honestly, excited to have you come to the booth, check out some of our new innovations, and please feel free to reach out to myself, your PDC rep, or like I said, come to the booth and check it out.
Let's go.
Awesome.
You ready?
Let's do it.